Oh, good, you made it. Welcome to part 2 of PT CVC 03, Programming Principles Plus. In this session, we'll look at the muscular system's response to exercise and get into some biomechanics. So the session will run for around 15 minutes, so you know the drill by now. Find a quiet space, free from interruption, and grab a pen and notepad. Let's start by looking at how our muscles respond to exercise. Okay. So we're fully aware that exercise has a positive effect on muscles and that inactivity will lead to muscular atrophy. However, we do need to know how training affects the muscle tissue and how we can program to ensure that we maintain and build on the positive effects. So one of the most common effects of exercise on muscle tissue is to produce hypertrophy, or an increase in muscle size. A client's capability to gain hypertrophy is very dependent on their genetics and testosterone levels. So training can elicit between 30 to 60% increases in muscle size, and most of the size increases comes from an expansion of the diameter of the individual muscle fibers and an increase in the numbers of myofilaments in each sarcomere. The number of mitochondria will increase, and there will be up to 120% more mitochondrial enzymes available in the muscle cells. So the muscle cells will also undergo a surge of ATP and phosphocreatine, around 60 to 80%, and the muscle cell will store 50% more glycogen and 75 to 100% more fatty acids. So what does that mean? It means that we have a greater anaerobic and aerobic capacity for each of our muscles, making the aerobic metabolic system 45% more efficient and giving their ability to work at higher intensities for longer periods of time. Okay, so we know how our muscles gain size and strength, but how do they move in order for us to gain these improvements? So we know that movement occurs when actin and myosin overlap and link together via cross bridges to generate tension. And that's when a muscle is active. In an underactive state, the actin and myosin have less of an overlap and less cross bridges. The relationship between the tension developed and how it's influenced at any point in a muscle's available length is termed length-tension relationship. So when a muscle is in an underactive state and there is less overlap of an actin and myosin and less cross bridges, it is harder to generate muscle tension. And once the muscle gets towards its shortest length, the actin filaments are so bunched up that they can't slide any further, so less tension can be developed here too. So if a muscle is loaded in its shortest or longest length, it's less capable of managing the load and is more susceptible to injury. So we would therefore be advised to avoid giving our clients lots of force at the extreme ranges. If we apply the length-tension relationship to exercise, a muscle will be capable of generating the most tension in the mid-range positions, and these are the safest positions for our clients' muscles to work in. We know that interaction between the musculoskeletal system and nervous system is essential for movement. And when we move, there's a fine balancing act between opposing muscles. When one muscle is engaged in an activity, another, for example, the antagonist muscle, will lengthen and yield in order for the action to take place. And this is called reciprocal inhibition, and it's the body's way of maintaining balance. Where reciprocal inhibition can become an issue, however, is when a muscle is chronically tight or overactive. And when muscles are repeatedly recruited, they become more active and shortened and can lead to this. This compromises the length-tension relationship and can lead to an imbalanced reciprocal inhibition, poor joint motion as well, and compensatory movements, and ultimately injury. As this muscle remains in an activated state, the opposing muscle remains in an underactive state and can lead to reduced recruitment capabilities. So the underactive muscle may test as weak, have less resting tension, and test as long in range of motion tests. So the combination of diminished activity and an altered length-tension relationship can become an issue if the muscle is required and is incapable of performing its role. So other muscles are then having to be recruited. This is called the substitution pattern, and more often than not, the muscles that step in are the synergistic for the movement, meaning that they're now required to perform the prime mover role instead of their supporting role. So this in turn will have an effect on how an exercise is performed and how muscles are recruited. So we need to be able to give our client feedback, and also for our client to understand the feedback and the appropriate technique, because we want them to be training with great technique. Our bodies receive constant feedback from and for everything our body does. And we have three different forms. So we've got internal or sensory feedback, which involves receiving and interpreting the signals via the nervous system. And it's crucial that we perform exercises with excellent technique so that our sensory organs provide correct feedback, allowing our body to interpret what we're doing and maintain good movement mechanics. As personal trainers, we play a major role in providing clients with external feedback and giving them additional information that will enable them to improve the quality of their movement. And we provide this feedback verbally, through touch. We can use monitors. We can also use mirrors and video, and also lots of technology is out there now to record and analyze. Effective external feedback adds to internal feedback of the clients and assists them to internalize the skill more fully. This in turn leads to their ability to perform the movement well and consistently. And finally, one of the most potent tools that a PT has to develop client technique is touch. When we use tactile feedback, the client's ability to accommodate feedback and correction of technique is increased. So remember to touch the part that you want the client to work. Okay, so now that we know how our muscles work and how we can give feedback and enhance movement patterns, we can start to explore our primal movement patterns and look at the biomechanics of exercises. So, our body has force placed on it from many sources, including gravity, which is a natural phenomenon by which all things with energy are brought towards one another. Load, which may refer to the structural load of our bodies, or forces which are applied to it in activities such as lifting and carrying. Action force is force acting in one direction, and we have reaction force as well, which is force acting in the opposing direction. Ground reaction force is the force exerted by the ground on our body in contact and while we are in motion, so when we're walking, running, skipping, jumping. Drag can slow us down as it's a force acting opposite to our relative motion, and buoyancy, which is an upward force that opposes the weight of an immersed object or body, can keep us afloat. So now that we know the forces that are being placed in our bodies on a daily basis, we need to ensure that we have a good base and support, that we have great center of gravity and balance in order to perform our primal movement patterns. These are movement patterns that humans have been performing for thousands of years and are the basis of all movement, including our exercises. So many everyday functional tasks involve combinations of our primal patterns, and we need to have an awareness of primal patterns as PTs so that we can make judgments on the quality of our client's movement and also appropriate exercise selection. So quality of movement is an underlying component of technical proficiency, and the information that a personal trainer is able to gather on the way that a client moves can be used to determine the readiness of the client to progress to more complex exercises in their program. It also allows the PT to judge the influence of intensity or load on a client, and this is essential for ensuring safety in exercise. So as PTs, we make decisions all the time. Being able to break down movement effectively can help us to determine where a client may need some extra work to ensure safe progression and to help them to become better overall movers. Remember, primal patterns are movements that everyone should be able to perform. So let's have a look at some movements now. Okay, so we've got our lunge, and this replicates the primal movement of stepping forward or changing direction off a single leg. To perform the lunge safely, our client needs a wide support base, so they should place their feet hip-width apart before stepping forward into the lunge. To challenge the exercise, we can make the support base narrower and progress into a walking lunge, or by placing one foot on an unstable surface, such as a BOSU. We can also change the direction that we do the lunges in, so laterally and diagonally. We can add load to replicate the movement of carrying objects while walking too. Okay. So we've also got the push-up. So the push-up is very similar to the movement of getting out of bed or off the ground. And to perform the exercise, the client should start lying on their front on the floor with hands flat on the floor, level with their armpits and slightly wider than the shoulders. If the client's unable to do a full push-up on the toes, we can provide an easier and safer option by trying to do the push-up on the knees. If this is still not possible, use a standing position with hands on a secure surface at a height of the anterior superior iliac spine. And then, of course, we would work towards progressing our client to doing push-ups on the knees on the ground and finally doing push-ups on the toes. To challenge the exercise further, we can also slow the tempo down. We can put the feet higher so we can raise them up to do a decline push-up, or we can place the hands on an unbalanced surface, such as a BOSU. We could also add a resistance band around the back to add more resistance for when we're pushing up. And finally, we've got a pull exercise. So here we can see a low row being done on some straps. And the action of pulling our body up off the ground, it can also be the action of pulling objects towards us. And also replicates, in part, the action of climbing. So this is a really important one. And to make the exercise safer, we can bring our client into an almost vertical position to perform the row. And to challenge them, we can get them further towards a horizontal position. We can also take their feet off the ground and turn it into a chin-up or pull-up that way. So they're raising their body weight without any assistance from the ground. Okay. So what I want you to do with those three exercises is go back through them, make some notes on how you can make them safer, how you can challenge the exercise, and how you can progress the exercise further. Okay. I hope that all makes sense for you. That's the end of part 2, and I hope you're raring to get out there and start using exercise that reflect primal movement patterns to assist your clients in being able to move more efficiently. In part 3, we're going to have a look at the effects poor posture has on movement, and we'll wrap the session up with a look at environmental training. If you're ready, I'll see you there soon.